So I talked about this non-opioid pain medication in one of my last videos, and I felt like the chronic pain community came after me. So let's clarify a few things. If you're frustrated with your chronic pain care, totally get it, and you have reason to be. However, I just ask that you don't shoot the messengers like me and others that are working towards something. Let's innovate together, let's create together, and let's make a better path forward for everyone. Suzetrigine, which is how I'm going to pronounce it, I have no idea how you do it. It works totally different than opioids, and this medication is not approved for chronic pain. I never said it was, and in fact, I said it was approved only for acute pain. See here. There were 2 phase 3 trials used to evaluate this medication that did in fact show it was better than a placebo. They evaluated it in post-surgical pain after bunionectomies and after abdominoplasties, and it was pretty clear that it improved pain scores sooner and better than placebo did by upwards of 2 points. Here's the data. So it's very clear that there is a difference. Was it as good as Norco, 5 milligram 325, hydromorphone Tylenol combination? The paper and the authors suggest that it was probably just as good, definitely not superior. However, I would probably question that and think that it's actually not. However, it definitely works. It has some benefit in these post-surgical pain patients. Also, a lot of people complain saying it doesn't work any better than Tylenol or ibuprofen. But I'm confused because Tylenol and ibuprofen work. They work pretty well. Obviously not as strong as an opioid, but your experience isn't everyone else's experience. I treat pain every single day in the hospital. I see these patients waking up from severe back surgeries that need PCA Dilaudid and all these other things just to control their pain. Then I see the same surgery in someone else and they don't even need Tylenol. They're fine. They get up and they walk away. So surgeries and injuries impact everyone differently, just like medications do. Now, yes, there was a phase 2 trial that was scrapped that was evaluating this medication for its use in chronic neuropathic pain. It did not work. There we go. So it doesn't work in that patient population. Does that mean it won't work at all for other chronic pain patients? We don't know. All we can say is that it didn't work in those patients with chronic neuropathic pain at that dose, at that schedule. Science is complicated and pharmacology is complicated, and medications don't work the same way for every single person. Otherwise, robots could just do our job. And yeah, I made a joke about Big Pharma sliding into my DMs, but that was clearly a joke. I've never taken any money from Big Pharma, and I never will take any money from Big Pharma. I don't even think I'm legally allowed to based off of where I work. I will talk about new science and potentially promising science when I see it. No, we don't have all the answers right now, and who knows, maybe this medication will cause people to grow a 3rd arm. I don't know. Non-opioid pain medications are worth looking into and investigating.